have a look at this clinical question. Okay, now, you see this question asks which of the following is the most appropriate next step? A little bit for those of you that are doing MRCGP exams. I know a lot of you are already qualified GPs and we don't need to think about exams anymore and you're happy about that. But for those that have got exams, exam technique is really important. So you can see only one thing. There might be some of these things that you think, oh, I'd like to do that and this and this. But if you ask for the most appropriate, there can only be one right answer. Okay, so only pick one. If you could only do one, and as the next step, having seen this patient, what would be the next thing that you would do if you could only do one? Okay, so the two popular answers are D and E. Okay, D is the most popular. Check FSH levels. Most of you picked that one. Okay, more than 60%. Following that, about a third of you picked check thyroid function, and then the others, it was a small proportion that picked, each one of the others. Okay, so the correct answer is E, check thyroid function. Why is that? Why is it not check FSH level? Again, if we look at the scenario, there's lots of information here. What is the one key that makes us think, okay, actually, we haven't got enough here to make this a worthwhile test to do as the next step? Yeah, well done. So the fact that her periods are still regular, there's no change to her periods, is really important. Look at her age, very young. No change in periods. Now, if you look at some of the symptoms she's got, yes, things like concentrating, being difficult, feeling tired, night sweats, you can sometimes get some of those symptoms around the menopause, but alongside changes in periods, right? Okay, the fact that they're still regular, no change to the periods, then you've got to think, what else could cause some of these kinds of symptoms? And that's why checking thyroid function would be a sensible next step, okay, given her age. Now, of course, her mother experienced these same things, but age 50, it's normal to have. In fact, 50 is the average age for women to go through the menopause in the UK. Okay. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.